I decided to research what quad limb symmetry index looks like in return to running protocol. So kind of my purpose behind this is the prevalence of ACL injuries is over 100,000 per year, along with the reconstruction. Um, and those who return to sport less than 9 months following the reconstruction increase their likelihood of re-injury by 7 times. So I kind of wanted to get a better understanding of more so in the running population when the best time to return to run is. So the study I looked at isokinetic quadriceps symmetry, helping in the decision to return to running after ACLR. So the study was a 10-year retrospective study from 2007 to 2017, with testing completed at 4 and 6 months. The purpose was to determine the association of quadriceps limb symmetry index of 60% at 4 months post ACLR and return to running. Participants had to be at least 18 years old, have the bone patellar tendon bone or hamstring graft ACLR, 2 testing sessions at 4 and 6 months post-op, and did not return to running prior to the 4 months post-op test. And they also had to have the will to running, meaning like a motivational aspect of it. And they had to perform the accelerated rehab program after the surgery. Excluded was a revision, osteotomy, PCL reconstruction, multiple surgical procedures with like MCL or LCL, or a contralateral ACLR less than 24 months before the one they were currently having, and then any other limitations that prevented any isokinetic testing, so like positive pivot shift test, significant swelling, or knee locking. Um, For the participants, there were 711 participants gathered. After all inclusion and exclusion criteria, 470 of them were included in the final study results. For the methods, they took at 4 and 6 months post-op, or sorry, at 4 months post-op, they took 60% isokinetic cutoff score at 60 degrees per second for limb symmetry index to determine if they were appropriate for return to run at a moderate intensity. So if they had a limb symmetry index of greater than 60%, they were given this running protocol listed below for those 2 months. If not, they were only recommended to do cycling from 50 to 60% or swimming from if they had less than 50. Then at 6 months, the participants were split up into 2 groups, return to run and non-return to run, based on if they returned to run regardless of their recommendation. So some of the participants returned to run despite not being authorized to do so. Even if they weren't at that 60% limb symmetry index, some of them did returning to run. So if you look here at the results, 226 participants returned with the 60% limb symmetry index, which is what the recommended return to run. And then the very bottom there, 140 did not return with less than 60. So those were the two groups that kind of followed instructions, for lack of better words. And then those 2 middle groups, the people that did return to run with less than 60% LSI, they kind of went against the rules and just kind of did their own thing. And then the 59 participants that did not return with that, even though they were allotted, like they were allowed to, they said it was more personal factors and like fear of movement. So for the results, there was no graft failure occurred during any return to running. So that was a good sign. Then just a couple other parts of the study, they noted that people who underwent the hamstring strand procedure were 2.6 times more likely to reach that 60% index by 4 months. And those without knee complications at the beginning of it were 1.18 more times to reach 60% by 4 months as well. And then at the bottom here, you can see those in the non-return to running group that returned against recommendation, they could tolerate the running, but their performance and recovery were a little less optimal than the group that had the higher quad index. So here you can see that sensitivity predicted 83% correctly identifying a high number of individuals to return to run, and then the specificity of 70% identifying those who were not ready to run. So overall, pretty reliable study. My main discussion points here, the 60% isokinetic limb symmetry index can be utilized as a tool for decision making to return to run. However, there are some things to consider, such as patient symptoms and confidence. Like I said, a lot of patients did not return to run even though they were allowed to, just because of the kinesiophobia, and they did not want to, or they had other factors like pain and they just kind of didn't want to push through it. And then obviously pain level and graft type, like I talked about, depending on what type of graph they had, they kind of noted that there was more likeliness that you could get that 60% with the hamstring graft. So there's my references that I used for the study. And I'm going to stop sharing my screen now, and we can kind of just discuss in the Zoom meeting, Teams meeting. So my kind of first question was, what kind of other types of return to run or return to sport type of cutoff scores have you guys noticed in your like clinicals, or have we talked about in class or anything like that? Like obviously isokinetic testing is ideal, but it's not necessarily the most accessible to all other places. So can people tell me kind of like what other things they've seen? Yeah, Garrett.
I was gonna say, okay, but I was gonna say like hop testing, like single like hop testing, triple hop testing, then the Illinois like it's a return to agility thing, and then like a 5-10-5 like agility run.
Okay. Have you guys seen, I guess maybe more of a quad strength type of cutoff score or anything like that?
Talk about leg press.
Leg press. Yeah. So I've personally haven't seen this one specifically because isokinetic is obviously more in the athletic population, and my clinical was not at an college athletics type of setting. It was just a general sports medicine. So a lot of the things that we used were more of like the handheld dynamometer type of testing with the quads. The hop testing, like Garrett was talking about, was more of like the end stages. So like more like 12 months post-op, where they're kind of getting returned to more sport specific stuff, not necessarily like initiating the run. But yeah, like kind of what Judd said, we were talking about with James in sports. The earlier that we have that higher limb symmetry index, the better it can be for outcomes and early rehab, but also there is a likeliness of re-injury when you're quad strong because then you go back too early. So what other like factors do you guys think play into return to run other than quad symmetry index that might contribute to that return to run a little earlier?
That cognitive that we talked about, like that's why I like just would do like the hop test, also do like the neurocognitive with it.
Yeah. Yeah, I really like that. I kind of only saw like the very, very beginning of some people's return to run. But my clinic used a lot of the Alter G treadmill. I think that can be good in its own way, but I feel like the best way to do it is really assessing that quad strength, because it's good to have that neuroplasticity by continuing that movement pattern while running, but also having that weight bearing aspect of healing is pretty important to me. What type of activities do you think are beneficial to those trying to gain that quad strength back for specifically running? I guess if that makes sense.
Return to run progression. So they would do like clearance for return to hopping first. So they would do like the 8%, and then like I think it's like 20 heel taps off the start inch box. And then once you were returning to hopping, they would do like plyometrically, like how many foot taps before. So I think it's like somewhere between 200 and 300 foot contact before they would let you start running. I think it's supposed to equal like 1/3 just to see if they could even tolerate that much before actually clearing them to run.
Okay. Yeah. I was kind of going to segue into that next, a little bit more of the plyometric aspect of training. Because my personal thoughts on, yeah, you can have kind of that isokinetic quad strength of just sitting still, but I feel like a better indicator of return to running is a more dynamic thing, because obviously running is not stationary. and you're constantly absorbing forces and not just pushing, more of that closed chain type of activity like you were talking about. Yeah, anybody else?
Like just unilateral stuff too. Doing double leg squats, probably do like single leg squat progressions and things like that.
Yeah, I really like that as well. I think I read like an article about something like 90% of most sports are spent on one foot. And so even as running, you're never, in a on two legs at the same time pretty much. You're always on one foot, especially in the running population.
Like in my clinic, we made sure that they could do a single leg sit to stand. Because if you can't, you'd be surprised how many people can't even stand up from one leg. So if you can't do a single leg sit to stand, then you're not strong enough to even
Right.
go back to running at that pace.
Yeah.
Something we talked about with Beck and I interviewed with Madison Mize, and she's a running PT at Nationwide Children's. And something she talked about, and that like I noticed with the kid that I worked with trying to return to run, is a lack of coordination in a lot of younger athletes. So trying, and we did this with our kid who wanted to return to football and lacrosse after bilateral knee surgery. We did like a lot of agility ladder drills before he fully returned to like jogging, and then we increased load with jogging as tolerated. But the first thing we introduced him to after plyometrics was the like agility ladder drills, and that was like a light jog, probably like he sprinted a little bit, but it wasn't like a lot of intense running straight out of the gate. It was very low volume, but doing it for like different purposes than just returning straight to run.
Yeah, I like that. Yeah. What kind of like you kind of talked about progressions of going from the agility ladder going all the way to running. What do you guys think, like what are key signs that we should progress, like something's too easy for them, if that makes sense? What are signs of something's way too easy or way too hard, if that makes sense?
Thing is I don't count the reps, and if I'm not counting and they're not counting and they are just keep going and have full conversation, it's not hard enough.
Yeah.
If I'm like, okay, what rep are you at? And they're like, oh, I don't know. And they've been sitting there and they've done like 35. It's easy.
Yeah, I definitely agree with that.
I was just gonna say, I feel like they start to progress themselves. Like our kid came back and told us, oh yeah, I ran 2 miles. And we were like, oh, we didn't tell you to run 2 miles, but he said he didn't have any issues with it. So
yeah,
at that point it was like, okay, you might be ready for more volume.
Yeah. Kind of my last point here, more of the subjective part of it. What subjective things do you think that like we should look for in terms of the return to run at the 60%? Because I know you noticed there was a lot of people that were allotted the ability to run, but they just chose not to. So what other outcome measures or tests do you think we could pair this 60% cutoff score with to ensure we're kind of making sure they're mentally and physically ready to run? Is there any other outcome measures or subjective questions that you guys might ask?
Could you do like the Tampa kinesis?
That's what I was thinking too. Yeah, probably. My initial thought was just generally asking, like, do you feel like you can run? Like, I'm not just gonna be like, okay, you're at 60%. The data says what it says. Go. And if I think I don't know the exact research, but I know there's a correlation between fear of movement and re-injury. So I feel like if we don't clear that mental aspect before we let them return to run, then we're probably not doing them the best treatment. We're doing them a disservice by just kind of pushing them too hard and causing future problems.
Madison mentioned in our interview with her, and like we talked about at the beginning of the semester in our elective, was the University of Wisconsin Running Injury and Recovery Index. She said she uses that with like almost all her runners that have been injured that want to return to the sport, or to running. And that like combined with the ACL RSI, I think gives you a really good subjective picture of how that athlete is feeling about returning.
Okay, cool. Yeah, I like that. Yeah, that was pretty much all I had for the discussion. Is there anything anybody wanted to add or anything that anybody wanted to comment on or anything else?
I feel like one thing I want to add, because I saw we had a weird case. That kid that I was talking about that was like the football player.
Yeah.
He was a weird case. So he had bilateral genuvalgum growth plate surgery.
Mhm.
And it was his second round because his first round he didn't have PT because of COVID. And the thing that was holding him back wasn't his knees, it was his ankles. So I feel like just keeping in mind that like there could be other joints to look at too is really important with running. He wasn't like as held back in returning to run. He was held back in playing center in football because he couldn't achieve a deep squat.
Mhm.
But I think just like keeping that in mind of look upstream and downstream too, because it's not always just the joint that was operated on.
Yeah, I definitely agree with that. I would say that you got to strengthen the entire, lower extremity in order to have a full quad activation anyways. So yeah, I definitely agree with that. Anybody else have anything to add?
Real quick, I was just gonna say, when we were talking about kind of what are some things to look at if it's too hard or too easy.
Mhm.
I know Dr. Grims has mentioned a couple times about like sometimes a good rule of thumb, especially when you're adding in like a neurocognitive layer, things like your technique can break down quite a bit. But I think this applies to any exercise like that might be a little bit more functional or more complex. If you have like two problems, it's probably too difficult with their technique. Like
Yeah.
one, maybe two, like slight problems with their technique that they can correct after you kind of cue them out of that, then it's probably a good difficulty for them, like, neuromuscularly.
Yeah.
But if they're having like 3 or 4 different like movement problems while they're doing an exercise, it's probably too advanced for them.
Yeah, I definitely agree with that. The one thing I also noticed in the article, I didn't really mention it yet, but it was specifically for return to running, but they also looked at like, I forget what all the sports were. There was like basketball, soccer, handball, like a bunch of different sports involved. So I really liked that it was kind of more versatile than just sticking to like football, track, cross country, one sport specifically, anything like that. I really liked how it could be applied to pretty much any athlete. Obviously, as they progress in their treatment, the sport specific aspect comes into play, but that's a little bit later down the road than that 6 months they looked at in the study. So, yeah. Anybody have anything else to add? Alrighty. Well, thank you guys. Appreciate it.